Welcome. Sorry, we have a bit of a. Actually, this is not the AI piece. We are in the discussion of the how AR, VR, MR can revolutionize customer experiences. That's this our topic for today. So I wanted to welcome everybody and thank you. As she said, my name is Daryl Tagashi. I am a full-time uh, faculty member at Purdue Global in computer science and innovative technologies. I also wear multiple hats. I'm the director for the Collegiate Cyber Defense Competition in Indiana. So I run a lot of the statewide competitions, and I'm also the president for InfoGuard chapter. So I get involved with a lot of the different aspects of industry as well. So that's enough about me. I'd like to bring up some of our panel. Umar, would you like to come up? I'll have them introduce themselves. They can talk about what they do and how well they do things and that.
Hi, good morning. Can everybody hear me?
Go ahead.
Thanks, good here. Okay. So I'm Dr. Umer Khan. So I am a practicing physician, internal medicine trained, and I work in a hospital-based practice. So I have been personally in health tech for a couple of years now, more than a couple of years. I saw issues in the healthcare industry and matters that needed to be improved upon. For example, patients forgetting to take care of their medications and missing their medications, and then ending up in the ER with DKA, stroke, heart attacks. So I went into health tech, developed mobile applications, patient compliance applications. I went into telemedicine, COVID-19 monitoring, and now I am deep into AI and exploring AR, VR. So glad to be here, and hopefully we will be talking in detail. Thank you.
What we're going to try to do is the forums kind of be open, but what we're going to do is have the panelists kind of go through the pros and cons from their perspective, like healthcare, et cetera, IT, and go through their different topics on that in terms of VR. And we are also going to kind of delve in a little bit on AI, but that's not going to be the main topic. We welcome any questions along the way, but right now we're going to push through on that. So we're going to go with pros and cons is the general topic on that, and from the different perspectives, we'll start with Umar.
Yeah, so pros and cons. Everybody can hear me? Yes. All right, great, excellent. So that's a huge topic. I think I am myself an optimist. And with every new technology, I think I go with more the pros. I want to build things, move fast and move forward, and especially you gotta maybe step back a little bit with healthcare because all the privacy issues and HIPAA and compliance. But definitely, I'm in favor of the pros. And just to give you a little bit of a background on this topic, that if you rely on any of the assessments about how big this market is going to grow, so it is expected that up till 2030, the market, AR, VR, in healthcare specifically, that's what I'm going to be talking about, will be growing around 25% every single year. And by 2030, the market expected to reach 22 billion. So this is a space to really look at. And in healthcare, the thing to notice is that healthcare is not like a gaming industry or something that has utility for the common public. Healthcare, you definitely need to have use cases and real incentives, whether it is cost reduction, better patient outcomes. So healthcare is specific with that. And you can have the latest technology, the best gadget out there, but if it's not really useful, I would think that could be a con possibly. But looking at the pros first, for example, let's have a raise of the hand. How many people have been to the hospital and they found it difficult to find your veins for a lab draw? I think my veins are also problematic. So nowadays there is a AR device called AccuVein, and that increases the chance and the likelihood of getting your vein in the first go ahead 3 times. Now I prefer that. I don't want to be a pincushion. Second positive is from the surgical standpoint. And this is a huge topic. I'm just going to mention a few things. It has been shown, and this was a Harvard review, that surgeons who were trained using AR and VR actually learned faster, and they performed surgeries faster and quicker. And so that is the name of the game. Before, you had to find OR space, you had to see, okay, is this case for gallbladder surgery? People and residents are fighting over who's going to get that case. And they had to mark, okay, you're next, you're next, you're next. Nowadays, you can train ahead of time and be much more prepared, from sutures to invasive surgeries through AR and VR, and that is being done. So that is a huge, huge positive. So the cons could be, as we can well imagine in healthcare that I mentioned earlier, privacy, HIPAA, security, hacking, as you were discussing a little bit earlier. So yeah, that is probably is the major cons in healthcare. Data and privacy, HIPAA compliance is a big issue in healthcare.
Wow, there's a lot of topics being talked about right there. I think from our side, from the education side, the use case is really the fundamental thing to start with, because not all use cases are applicable in AR or VR or anything like that. And to be able to see whether you have any advantages, like we've tried, what we've done is talking about from the education side and say maybe take our policy class, or maybe our nursing class, or maybe a cybersecurity class, and looked at it and seeing the topics or the outcomes that we want to look at in those particular classes, whether it's appropriate or you really gain anything from putting it into VR, XR. So the use cases, I think, is very important. Like you were saying about expense, you don't want to spend all this money on something and then I'll find out that, it really doesn't really buy you anything into that kind of stuff with that. The other part that we've looked into is on AR. We're a remote school, Purdue Global, and we talked about if you do AR, each student would have their own unique things and they could see things in the background. And talking about privacy or any considerations from that point, not even at a HIPAA level, you may, if I, like when we're in meetings, right, we like to blur out or have some kind of virtual background image to kind of blur out what our background is, depending on what room we're having our meeting in. It's a similar constraint that we were looking at is with the students, do they really want to reveal some of that stuff to the other classmates? And the privacy issues along with that piece of the puzzle. The other piece on that is going through when you are talking about proprietary stuff, you could have specific things. Well, being in cybersecurity, I noticed this thing. You do photo forensics, and you take a picture and then you can find out all this additional information from it. I kind of look at it from that perspective, but you have to be very careful with that, with different things, with doing things with that process of that. So what we looked at too is trying to figure out, also the piece of the puzzle with the privacy was also with the data collection. Because as we know with games, even with general games or even with general applications, they have that privacy policy. And I tell you now, I've been reading more of those privacy policies that come up, whether you want to use that application to get a general idea of what that came up also with AI. In the beginning, they were using some of the information you put in the prompt to train their models. And now, that's a big thing, and they're kind of trying to be explicit at that as to whether how are they using the data or the prompts that you're putting into the system. So those are different things that we've looked at from a VR, AR perspective, that, when we are developing, when we're at the other end trying to develop an application, what information are we collecting? Because a lot of times from an educational point of view, we are looking at research, right? And we want to pull in a lot of different data, and try to figure out, what's working, what's not working. But then there's the ethics side of that. Is that something that we should be pulling into? Should we be doing that? And how transparent do we want to be with the students? We should be very transparent as to what data we're collecting. So they have an option to opt out and say, no, I don't want to do that. I don't want to give you that information. Or when they're signing up for an application, they say, are you 18, or all these different demographics that we're looking at, those different areas of things. So.
I have a comment Humberto was mentioning. So for SaaS startups, perhaps, given the current landscape and the bandwidth, how is scalability? I'm going to have you answer that, but I want to touch on a topic that Erwin mentioned regarding cyber sickness. So if anybody doesn't know, cyber sickness is a term for motion sickness that you get while having these sets on your head. So there were a couple of studies in the healthcare space that were done on ICU patients. So cyber sickness is something to look at, but it's not that prevalent. So that's not a huge problem. Bigger problem is strain, possibly on the eyes, neck strain, and the dryness. And this was on ICU patients, but definitely something doctors and everybody will be looking at, and you will be getting calls. Hey, I'm having nauseousness and a headache, just like anybody has in motion sickness. And just want to touch on one aspect, and I was mentioning a few use cases earlier from the client experience or the user experience standpoint. So in healthcare, I see this changing numerous aspects, training perhaps, but one thing that everybody can understand probably much easier is that, for example, people in the ICU or on the medical floor perhaps, and they are bedridden, right? 90% of these people who are elderly over the age of 60, they end up needing rehabilitation. They have to go to a rehab center because you can't move patients around. Now you put a device on their head, on their face, and they're able to do motions and move their extremities and legs so that they don't get deconditioned. Now you and I, if we stay in bed for 2 days, we'll be fine. But somebody who's over the age of 65 or 70, they stay in bed for a day, they won't be able to walk the next day. So especially with all the stress in the hospital and the ICU.
Yeah, I'd like to make a comment on the cybersecurity side. I think we keep it simple and look at it as a new application, irregardless of the technology or the use case of it, and apply it to our policies or add new policies like AI. We had to add new policies to our IT procedures to look at additional things that are specific to that particular AI, AI in general, or into VR and that kind of stuff. So I think from that policy procedure side, if we can kind of make sure that we do our natural audits and be able to, when we add any new system, like if I add a new access point to my system, there's got to be a policy for that, right? For security and all that. So as long as you keep that general policies concepts or keep it simple to that, I think then you'd be good. You'd be good with that. You may not know all the answers for that or see all the loopholes for that, but at least that's a start so you can address that and then try to learn a little deeper onto that. I'd like to open it up for any questions or anything. We have a few more minutes, 5 more minutes. Are there any questions? Let's see with the lights. Any other comments, Shelley?
Yes, somebody has a question?
Oh, yeah. Be careful.
I can be the guy.
I think the question is for the three of you. Which industry do you see that could leverage AR VR the most? That probably will be what do a lot of the enhancement or development, and then the other ones will benefit from it.
I see it in education quite a bit, especially there's a move for remote. And with our students, I think the missing piece of the puzzle is a lot of times we have this interaction, right? I'm sitting here, I can see, I have, you got body language, you have people's faces, you can kind of see and that kind of stuff. With AR or with the VR, we have those rooms that you can get into. We've experimented with getting into some of the standard rooms and even just having um, the video on for the students, and they're kind of just see the face, but they're in the room and they're kind of interacting. We see a little bit of an engagement difference with that. We see that as a thing. Go ahead.
Maybe since I'm a healthcare guy, I think healthcare is probably the main. So apologies for.
Well, no, you're fine. You're fine.
So I like to look at it as training for both doctors, residents, ALS, BLS, how to do a Heimlich maneuver, everything related to healthcare. Then information, patients communication is a big issue. People don't understand, and doctors and nurses don't have the time to, go down at the basic level to explain everything in detail. AR, VR will be, suitable. Then performance. We talked about surgical performance and outcomes are much better, and training of students in Q&As with the patients and providing feedback. Then sedation purposes or pain control purposes. You can, for a certain period of time, you can have patients forget about their pain, forget about their worries, and make the patient experience a little bit better. So I think that that's probably healthcare. Healthcare is going to be huge, and connected with AI. I think this is going to be huge in the future regarding the use of Da Vinci robots, where currently suturing is being done very aptly, much quicker than through a doctor who's been being trained. So I think healthcare is huge in the application of this technology.
And I will say that in our research and trying to find existing VR experiences, healthcare is way ahead in regards to building experiences that are out there versus any of the other fields that we've been trying to kind of acclimate into, like cybersecurity or anything like that. But we also have been talking with our healthcare department and talking about those types of similarities where patient interaction. The same with us, where we have a student come in and maybe having a C-suite interaction or an IT manager interaction or being able to talk to a group of people, those kind of things like that. So we're trying to find commonalities where, like the cost effect, where we can program some similar types of experiences and cases, but we change the scenario a little bit so that it fits more maybe the healthcare versus IT or something like that. So.